So it's my pleasure to introduce today's session with Dr. Rosalyn Singleton. And Dr. Singleton has worked as a physician and a researcher with Alaska Native American Indian people for over 30 years. Her research partnerships have been related to vaccine preventable infections, respiratory infections, vitamin D deficiency, and bronchiectasis. Roz has worked especially close with the Yukon-Kuskokwim Health Corporation and has been linking research opportunities to address regional health needs. Most recently, she has turned her attention to COVID-19 and her vaccine study. She advocates and works to advance tribal sovereignty and research has contributed to positive health benefits for Alaska Native American Indian people. Dr. Singleton graduated from Northwestern University Medical School, Chicago, and completed a pediatric residency at Children's Memorial Hospital in Chicago, and holds an MPH from Loma Linda University. She has worked on the Navajo Nation, the Alaska Native Medical Center, and the ANTHC, as well as the state of Alaska. She currently works at ANTHC as a research physician, and she's also worked as a guest researcher with the Arctic Investigation Program, CDC, Center for Disease Control in Anchorage, Alaska, for many years. And it's with great pleasure that I turn it over for her next two presentations today, and I thank you for your attention.
Thanks so much. We're delighted that you could join us today. I wish I was in person with everyone. And I'd like to introduce Jenny Dobson, who's going to be joining me today. That we're going to be discussing a study in which ANTHC, SCF, and YKHC participated, a nationwide study. And Jenny Dobson is the YKHC coordinator for this study. So she's going to be sharing in this presentation with me. And I have here just a list of the some of the key folks involved in this study locally, but there's far more that I'll share at the end. And you can see this study involved wide representation from all these three tribal organizations. So without further ado, everyone knows that the worldwide COVID-19 pandemic caused by the SARS-CoV-2 virus has lasted now over 16 months and cost 600,000 American lives. American Indian and Alaska Native people have had some of the highest rates of COVID-19 illness in the country. If many of you know, the Navajo Reservation has had over 1,300 deaths in a population of only 175,000. In Alaska, the Yukon-Kuskokwim Delta was one of the hardest hits and had the highest rates of COVID-19 illness, and they've done an incredible job in addressing COVID-19. Two COVID-19 mRNA vaccines, Pfizer and Moderna, were authorized for use in December 2020. And phase 3 studies before this, involving over 30,000 adults for each of these vaccines, showed that the vaccines were about 95% effective in preventing COVID-19 illness. These were in placebo-controlled trials. But now, after the COVID vaccines were in general use, it's absolutely critical to evaluate effectiveness in multiple populations for a number of reasons. One, it's uncontrolled. Two, you are dealing with a lot wider age range and individuals with underlying conditions that wouldn't be included in many placebo-controlled trials. And the third thing is we've got different transmission around the country. And then we have the issue of variants occurring, which can affect vaccine effectiveness. So it's really critical to get this real world view of vaccine effectiveness. We all know that healthcare workers were among some of the first groups to be vaccinated. And at ANTHC, SCF on AMC campus and YKHC, employees started receiving vaccine around December 16th. So in October 2020, two months before this, the Centers for Disease Control approached ANTHC, SCF, and YKHC to see if they were interested in participating in a nationwide study to evaluate effectiveness of COVID-19 vaccines in preventing symptomatic COVID. And I am just delighted that the three organizations worked very quickly to get approval and to participate in this study. And so ANMC, including both ANTHC and SCF employees on campus, and YKHC, participation in this 33-site, multi-site study started actually on December 29th officially, but it was really the first of the year. So just very shortly after the vaccines were authorized for use. And healthcare workers who were tested for COVID-19 at ANMC or YKHC were eligible. They were the eligibility was basically if they had direct or indirect contact with patients or infectious materials. So we were offering to people on campus. So the research personnel asked employees if they could be contacted about participating in a COVID study. We did this different ways. We had at ANMC, we actually had as part of the survey, the online survey that people took when they were getting tested on campus, there was a question about whether they were willing to be contacted about participating in a COVID study. And in YKHC, I'll have Jenny talk a little bit about how they elicited interest. This was a test negative case control design in which healthcare personnel who tested positive were cases, and then we enrolled 3 healthcare personnel who tested negative as controls for each case. The study involves a phone or electronic informed consent. This was actually the first time I had used an electronic informed consent, and in general, it worked very well. We sent the informed consent through email with a link to our secure website. And then when signed, the informed consent automatically populated on the website. And the study basically involved an interview and review of medical records to confirm COVID testing, COVID vaccines, medical conditions, and symptoms. And it did not involve any blood or specimens. And basically the design was to evaluate the vaccine status in healthcare personnel who tested positive versus those who tested negative. And I'm going to turn it over to Jenny for the next couple of slides. Jenny?
Thank you, Dr. Singleton. You will see here on the slide we have recruitment posters. I feel very strongly that every research study I've ever worked on has started with some kind of recruitment poster. So for this project, like Dr. Singleton explained, we were targeting healthcare workers, but the definition of that was pretty wide. So it went beyond what you would traditionally think of as clinical professions. And we really wanted to reach out to anybody working in a healthcare organization that might have direct or indirect contact with not only patients, but also infectious materials or surfaces. So that really opened it up to a wide range of health professionals. At YKHC, we determined that approximately 90% of our employees really fit into this category and would be eligible for the study. So there were really 2 factors that we considered. Number one, was it we'll just go back 1 second. Was it a healthcare worker who fit our category? And number 2, was a healthcare worker routine being tested for COVID-19? And at YKHC, one of the ways that we determined interest was by amending our COVID testing forms. So anyone getting tested at our main site in Bethel was able to check yes or no, it's okay to be contacted about the healthcare provider COVID study. And then employees that were working outside of our main site at Bethel were able to contact us directly to sign up to participate in the study. Next slide, please. Thank you. All right, so right here we have some numbers representing participation. And I just want to say to start out that these were our numbers as of April 15th. And Dr. Singleton mentioned how quickly this study ramped up. So between about January 1 and April 15th, this represents our participation. So at the top, you will see that the number of employees that were potentially eligible for the study were over 6,500. We had over 2,700 at ANTHC, 2,400 at South Central, and over 1,300 at YKHC. The next row below, you see the number of contacts and outreach effort. ANTHC and South Central Foundation especially did a tremendous job with these outreach and contacts. And so we ended up reaching out to almost 3,000 employees or contacts during that time period. And at the bottom there, you will see our number of participants that were recruited and enrolled in the study. We had 35 cases, 102 controls in mid-April, and that is 137 enrolled participants in the study. Next slide, please. Thank you. Now, this is just a little bit of information about those 137 participants that we were able to enroll in all of the Alaska sites combined. So on the chart, you will see Alaska Native Tribal Health Consortium and South Central Foundation represented on the left side of the chart, and YKHC is represented on the right side of the chart. And we broke down the demographics among our participants. So at YKHC, over again on the far right side, you'll see we had about 78% participation from females. The other sites also had a similar rate of participation there. You'll see that Alaska Native participation is represented with the orange bar, and we had 51 and 61% participation from Alaska Native participants. You'll see physicians and nurses ranged around 22 and 19%. And on the very far right side of the graph, you'll see that for the Bethel site, we had 27% of our participants were located outside of the regional hub of Bethel at one of our remote village sites. Thank you. Next slide. And I'll turn it over to you, Dr. Singleton.
Thank you so much thank you so much, Jenny. I think one of the exciting things of this study was the degree of contact with, as Jenny said, almost 3,000 healthcare personnel that were willing to participate. The interim results overall for this nationwide study were reported in the MMWR on May 14th. And the good news is the study found that 2 doses of mRNA COVID-19 vaccines were 94% effective in preventing symptomatic COVID-19 among healthcare workers under real-world conditions. That is very, very reassuring to me personally, and was very exciting to be part of this large effort to look at real-world effectiveness. The interim analysis only went through the end of March, and actually the future plan is that the full results are planned to be published in hopefully in the New England Journal of Medicine. Is going to be submitted shortly. So here's some overall study results. 1 dose effectiveness was actually 82%, which is reassuring that even after 1 dose, there's substantial protection. This study involved overall 623 cases and 1,220 healthcare personnel. There were something like 90,000 healthcare personnel represented in the facilities, in the 33 facilities that participated. 75% of the cases were 19 to 49. About 60% of the cases had substantial direct patient contact. 84% overall were female. 64% of the cases were non-Hispanic white, and 77% of cases had an underlying condition. And the cases, as you might expect, so these were positive, COVID positive cases, had more fever, more cough, more shortness of breath than the controls, as you'd expect. One of the exciting things that I saw from this study locally was the impact that we saw of high rates of healthcare personnel vaccination on the percent positivity of COVID-19 testing. And as part of this test, as part of the study, we looked at the overall COVID test positive for each of these facilities, for ANTHC and for YKHC. And this is an example from YKHC, and you can see after the first 5 weeks of this study, the COVID positive test rate among healthcare personnel dropped almost to zero. And actually, this made it very difficult to accrue new cases. So it made it the study challenging, but it was very reassuring to see, even while there was significant transmission in the communities during this period, that among healthcare personnel, there was a significant and dramatic drop in the positivity rate, even during the study, that was related to high rates of vaccination. So I've asked around to get some of the benefits of participating in COVID vaccine studies, and Denise Dillard has been really helpful in some of the initial discussions, along with Tim Thomas and Dr. Kleka, Joe Kleka in YKHC. Some of the benefits of participating in studies is representation. We're represented in the COVID studies, and that's very important. We're part of this. We're part of getting information that will be helpful for not only us, but for others around the U.S. And also, we're doing something. Our YKHC research coordinator, one of the biggest things this did for me and others was it gave us something worthwhile to pursue during the pandemic when we all felt powerless. And I think that was another issue for me personally, was doing something actively and watching the results. And then last of all, I just wanted to show just the large number of individuals who were involved in this study. I want to thank Dr. Mark Fisher from Arctic Investigations CDC, who initiated the discussions with ANTHC, South Central, and YKHC about participating. And then you could see this robust research staff. And I'm going to okay, there we go, that we had that participated in this study. It was very reassuring. So with that, I'm going to end and see if, Abby, can we take questions now or should we wait?